Welcome to today's Evidence Hour, Helping Without Harming, educating mental health professionals on working with survivors of IPV. The Center for Victim Research is holding these Evidence Hour webinars to showcase systematic reviews and meta-analyses that examine an issue of importance to victim service providers, advocates, researchers, and others. It is my pleasure to introduce today's speakers, Amber Sutton and Haley Beach. I'll let them tell you a little bit more about themselves, and then they'll share what they learned and what it means for practice and advocacy.
Well, thank you. Hello, everyone. It's great to be here with you. I wanted to take a quick moment to thank Susan, as well as the Center for Victim Research for inviting us to be a part of this incredible series, as well as my colleague and friend Haley Beach for continuing to agree to go on this wild journey with me and show up and say, let's do this thing. And also to all of you for choosing to spend your afternoon with us to learn more about how to effectively help survivors of intimate partner violence. So I wanted to start off by sharing a little bit about me and my background to give you some more context. So my name is Amber Sutton. I am a licensed independent clinical social worker here in the state of Alabama. I'm also a current PhD candidate at the University of Alabama School of Social Work. And my dissertation is actually focusing on research combining the intersection of COVID-19, intimate partner violence, and intimate femicide for victims here in Alabama. I have 33 years of lived experience, including 2 years of motherhood. And why I chose to start with lived experience is that we have become so professionalized, which can be incredible. It can be a positive thing. I'm incredibly proud of my education and my background. But sometimes our lived experience tends to take a back seat and it's not valued at the same level. And so I really want to take an opportunity to not only share my lived experience, but to invite you to realize and understand that your lived experience brings value to, and it brings value to this work. I also have 10 years of professional experience, and so I have done every role imaginable within the IPV field, including being an advocate at grassroots organizations. I've worked on high lethality cases. I have worked in the criminal system, so I actually was a victim advocate and held the felony caseload in St. Louis for the Circuit Attorney's Office. I have been a supervisor, and so worked in administration where I was supervising fellow advocates. And currently I actually serve as a therapist for Talkspace, which is a safe and confidential telehealth provider. And so 100% of my caseload actually includes survivors of intimate partner violence. And so I have worked many of positions, and all of them have been valuable, particularly to the work that I do now. I'm white, I'm a cisgender heterosexual woman. I am a childhood and adult survivor of intimate partner violence. I'm a mother, I'm a feminist at my core. It's my value system, it's how I live my life, it's how I do this work. Social worker, advocate, author, educator, therapist, researcher, and proud introvert. I was born in Alabama. I have lived here for the majority of my life with the exclusion of St. Louis for a few years. But I was actually born to a teen mom. I come from a working poor background. And I'm actually a first-generation college student. And what I always tell people is that I am a trauma victim through others' doing, but I am a survivor and thriver by my own choice. So. Haley, take it away.
Yeah, hi, I'm Haley Beach, and it's so good to be here with you all. And thank you so much for having us today. And I'm just excited to be here with my colleague and friend Amber. We've been doing this work for several years together, and it's just incredible to be able to share kind of what we've learned in this process and working together. So I'm a licensed master social worker here in Alabama, and I'm also a PhD candidate at the University of Alabama School of Social Work in my final year. working on my dissertation. And my research and dissertation area is specifically looking at maternal health and obstetric violence in hospital settings in Alabama. So really that intersect of systemic violence and interpersonal violence within hospital settings for mothers during pregnancy, childbirth, and postpartum. So I have 6 years of professional experience, social work, nonprofit, you name it, I did it. And I have 7 years of parental experience and 35 years of lived experience, which all have served me incredibly well in this work and have informed me in a lot of what I do. So as far as positionality, I just like to share my background and who I am to give you a better idea of kind of the lens in which I view this work and the way that I approach this work. We all have our own lived experience and privilege and biases that we bring to everything that we do. So I like to share kind of what mine are so you have a better understanding a little bit of the way that I view this work. So I'm a white cisgendered heterosexual woman. I'm middle class. I'm an unpartnered mother of 2. I'm a feminist, a researcher, a writer, teacher, and poet. I'm also an IPV survivor advocate and a birth trauma survivor. So all those varying identities really inform this work that I do and the way that I approach being a social worker, being an advocate, and being a feminist.
So we wanted to just take a moment of gratitude and to acknowledge, and so beginning with acknowledging the original peoples and tribes of the land upon which our agencies and organizations stand, the advocates who have come before us, who have made it possible for us to continue to do this life-saving work, particularly Black, Indigenous, and people of color who have really been at the forefront of this movement. I also want to thank all of you for the work that you do. Speaking as an advocate, I understand that this work is a calling and that we really do put our minds and bodies on the line every single day when we choose to engage in this work. I remember pretty early on in my career, I heard a speaker tell me that this is life and death work. And I remember taking that very literally, and of course, you know, femicide and infanticide is a real product of this work, but I think even on a deeper level, what that meant is that I had to allow the old narratives and old parts of me to die so that I could become a better advocate. And so thinking about the constant unlearning and relearning that this work calls us to do on a daily basis, and noting that I can't promise that this webinar or this journey beyond this webinar will be comfortable. It certainly has not been for me, but I can promise you that it will be transformative if you allow it to be. And of course, let's not forget the survivors of intimate partner violence that are not only within our world and our country, but in this room with us today. And so what I like to say is that based on experience and evidence and research data that we know that survivorship is real, that 1 in 3 women will experience this, 1 in 4 men, not to mention people of other communities. And so I want to take a moment to thank you for your courage. Your stories and your backgrounds are foundational to this movement and to the data that we collect and analyze every single day. And I also just wanted to pause for a moment just to remember all of those who have lost their lives to intimate partner violence. So with that being said, I invite you to lean into this process, to acknowledge your own limitations as an advocate and as a human, but to also celebrate your strengths, your gifts, and your abilities that you bring to this work. And to find ways to take care of yourself during this presentation. So if you're finding that you're having a visceral reaction or a trauma response, that you do the things that you need to do to help cope. This webinar is not exhaustive by any stretch of the imagination. We could talk about each of these topics for days on end by themselves. And so I'm hoping that we can give you resources that you can then check upon following this webinar to better cover those areas, but we're also open to contact and for answering questions and having additional moments of connection. So So to begin with, how did we get here? So this is a really interesting question. This is one that I have asked myself many of times through this journey. And Haley and I can have a conversation about this together because I think we come at it from similar but also different perspectives. I was working in the field, and part of my job a lot of the times was to educate other people about intimate partner violence, including mental health professionals. I got asked many of times throughout my career to provide trainings because mental health professionals, including therapists and social workers, psychologists, substance abuse advocates, were coming to me and going, you know, we're seeing this issue, but we don't know how to respond to it. We don't really know how to identify it. We're uncomfortable talking about it. So we need tools, we need strategies. And so on the other side of that, I was coming across survivors who were coming to me and telling me, you know, unfortunate things that had happened to them that were being told to them by mental health professionals. And I started seeing a real need for a more consistent and streamlined training. And so once I got into the PhD program, I actually started in education. I was a social worker, but I wanted to start examining the way that we were training, particularly social workers that were going out into the field. And so that's kind of where my mind went. And then, of course, I met Haley, and so we started having conversations about our work. And Haley, if I recall, you were saying, you had mentioned about, I guess, not realizing how many people were affected by this issue. And then once you kind of figured out, looking at the data, it was shocking to you. Do you want to talk more about that?
Yeah, I think it was so interesting. Meeting Amber in our PhD program, we just clicked automatically, and we really found a lot of similar interests in our values and the work that we were doing. And we both love working with women, and my focus really is around maternal health and working with mothers. And Amber had been working in IPV for many years and also worked with mothers and lots of different populations. But, you know, I would hear her talk all the time and say, oh, you know, this, I can't believe this is happening and the level to which this is happening. And I just didn't really know that much about IPV at the time. And, you know, she would say it all the time, and I'm like, okay. But then once your eyes are open and once you see it, you can't unsee it. And so I feel like we have these conversations all the time where I'm like, oh my goodness, like there it is again, there it is again. And she's like, yeah. So I'm a little late to the party, but I'm still here. And I think that it's, once you see it, you can't unsee it. That's so true. And I think that it's everywhere. We talk about how violence is in the water. We're in it. You can't escape it. You can't get away from it. And so once you recognize that and start to see the signs, it really changes the way that you do this work and you look at this work and you kind of just look at life in general.
Yeah, absolutely. And I remember us talking about this idea of like, there is no social issue that intimate partner violence does not touch, that it does not connect to, right? Like, I remember, and I'm sure there's some people on this call that can contend to this, but like this idea of like in every training or meeting, I was always that really annoying person that would raise my hand and go, well, what about intimate partner violence? Because we tend to have this idea that we silo social problems and social issues. And one of the things that I have learned and will continue to learn is this idea of like intimate partner violence, violence against women, violence against communities of color, violence against queer survivors, right? Like it's all connected. And until we start looking at it through a more structural lens, we're never going to solve it. And so really kind of coming to this work just by way of meeting so many different providers and realizing that we're all sort of dealing with the same issues was really important.
Yeah. So today we have several learning objectives that we want to go over and things that we hope you'll be able to walk away with. As Amber mentioned, this is not exhaustive by any means, and we're happy to have follow-up conversations or send you additional resources. But we wanted to be able to give you an overview and give you some tools in your tool belt to be able to walk away with today. So we are going to examine the review of the literature that we did within our systematic review and kind of see what the research is saying. We'll also kind of be comparing that to our own lived experiences and work in this field in direct practice, and how those things kind of align or misalign. We will also be looking at this through an intersectional feminist framework that's really focused on social justice, and we'll talk a little bit more about what that looks like and how that approach is so critical to IPV work, and the way that we confront these complexities of abuse, how we safety plan, and how we truly honor lived experience. And then we'll also be looking at how to assist clients involved in IPV through this empowerment model, and what are some takeaways for today, things that you can do today, things that really are more hands-on, practical ways that we can continue to help survivors.
So I found this quote, and I thought it was really fitting to sort of set the foundation for not only the work that we do every day, but for this presentation in specific, that if you want to change the world, work on yourself first. And so to give a little bit of background for that, it's a funny story now, but at the time it wasn't so funny. So when I was graduating with my bachelor's degree in social work, it was during the recession, and so there were limited jobs available for bachelor's level social workers. And I remember the only position available were AmeriCorps positions. And I must have applied for 10 to 15 different positions all over the country. I was not planning to stay in Alabama. Actually wanted to run for the hills from Alabama. And luck would have it, right? Even though it's not luck, I think it's just life and the universe rising up to meet me. But what ended up happening was that the very last AmeriCorps position was at a domestic violence shelter here in Alabama. And I didn't have any options, and my partner was like, hey, why don't you go for it? I think you'd be great at that. And I looked at him and I said, I will never work in domestic violence. That is the last thing I will ever do. And lo and behold, I ended up getting the position. And what I realized is that through that first experience and the experiences that have followed me, is that I ran from this work because I was too close to the fire, in a sense. I had experiences that I had not yet healed from or had not done my work around. And what ended up happening was that there was a lot of countertransference, there was a lot of projection. And so as a young advocate, what I realized very quickly is that I could not continue to do this work or the work until I did my own work. And I think that that holds true for a lot of us. I think because of our own experiences, we are called to certain fields and movements and work, and it almost becomes our own form of trauma mastery that we end up doing the thing that we run from, right? Mm-hmm. Nothing goes away until it teaches you what you need to learn, and that's exactly how I view this work. It is incredibly meaningful to me. It is my passion to this day, even though I started out denying that, but have found my place in this world. And so really calling all of you to get really clear about why it is that you're here, why you do this work, why you feel called to this work, and being honest with yourself about that. And this idea of, if you are in this work to have power over people, this ain't the field for you. It is not about power over, it's about power with and empowering. And I think it is a counterintuitive way of viewing this work. And so I wanted to make sure that we really had a moment to talk about that, and to get Haley's thoughts about that, and just hear her opinion and perspective, I think is really important too.
Yeah, I think particularly in the field of social work, and I know other professions and their training, there's really a lot of idea around cultural competency and mastery of different areas and fields. And for me, I really look more to cultural humility and this idea of inward reflection and reflexivity on what is it that I bring, what is it that my bias and my lived experience and my privilege empowers bring to the table and bring to this work, because I think without recognizing that, I think we really can do unintentional harm and really can harm people, and that's not what any of us want to do in this work. But we really have to look inward first to really figure out who we are, what it is that we're doing, why we're doing it, asking all the hard questions. And I think a conversation that Amber and I have all the time is that this is a process, not an outcome. It's not something that, again, that's that cultural competence versus cultural humility, like, okay, I got it, check. It's really a lifelong process. It's something that you have to do every day, sometimes minute to minute, and really be critically reflecting on who you are and what you bring to this work.
Yeah, absolutely. And this is our plug to give you permission that you don't have to be the expert. That doesn't need to be the expectation. That shouldn't be the expectation. Do you have skills and knowledge? Absolutely. Are you the expert of other people's lives? No. Right? And so in a way that can be scary, because I think we are taught that you have to have an answer, that if you don't have a solution, right, that something is wrong with you. But the reality is that uncertainty is just a part of this work. It's a part of working with survivors, right? And it's also the unlearning of what it means to not be paternalistic and not try to rescue, fix, pathologize, or judge survivors. And so just asking yourself, right, like having that conversation with yourself, I think is a really important first step, and continuing to have those conversations with yourself and others that you trust, to really be able to talk about that. So. Oh, sorry, y'all. So kind of going off of that conversation, I thought it was fitting we have the word help within our title, but thinking about how you define help. And so I wanted to, Haley's going to read this because I think it's really powerful, her spoken word, but I think just to give you some background, so Guy McPherson is a trauma therapist. He actually has a podcast called The Trauma Therapist, and when I started doing individual therapy, I came across this resource, and it's been incredibly meaningful to my work. And so, Haley, would you like to read that?
Yeah, absolutely. Be encouraged to truly think about how you define that word help. Being a therapist, working with those who have been impacted by trauma requires that you, the therapist, or fill in the blank, know how you define that word help. It requires that you understand why you got into this field and what's drawn you to working with people who've been traumatized. We each have our own reasons, and we each have to be clear about those reasons. This kind of self-awareness isn't always easy because in a sense, it shifts some of the light onto you and away from the client. It's about relationship, and we're a part of that. It's about exploring your role within the therapeutic relationship. It's about exploring what it means to be authentic and what it takes to cultivate that. It's about exploring the story of your life, your ups and downs, and way, way downs, and looking at how that may impact the therapist you are.
Yeah, so I think, again, this is just another example of how deep this work goes. There is no such thing as being objective. That is my view. That's how I live my life now. I think I was very comfortable with this binary thinking of everything was black and white when I first got into this field, and then realizing that this issue is incredibly complex. People are incredibly complex. You as an advocate are complex. And so I think really being honest and taking a stock about, again, how your biases, how your assumptions, how your experiences show up in your work, how being a survivor has shown up in my work, both from a helpful standpoint and also unintentionally harmful. And that at the end of the day, I think this is the most powerful advice I have been given, is that you are not responsible for survivors, you are responsible to them. There are things that are just beyond our control. There are days where I could literally work every connection I have, right, advocate to the best of my ability, and maybe solve 20 to 30% of the issue, right? But there are things that are beyond our control. And so I think understanding and asking yourself, have I done everything in my being to help this person? If so, that has to be enough. You can't be responsible for other capable adults, right? And so I know that's a hard pill sometimes for us to swallow, but again, I think getting away from this rescue mentality and really leaning into this idea of like facilitator and collaborator versus expert versus I'm here to impart knowledge. It's more about a collaborative relationship with that person.
So now we're going to go into a little bit more about the systematic review itself and what we found. And so I just wanted to give a definition of what systematic review is. And so essentially, it's just a very methodical approach with specific criteria that you choose to be able to answer a specific research question. And so for us, our research question, sorry, thanks.
You're welcome.
So we really wanted to better understand how are mental health professionals, or MHPs, in the United States prepared to work with survivors of IPV in practice settings. So we kind of created this general question and really wanted to better understand what the literature had to offer. And so in this very methodical process, there are specific steps you take to actually do this. And so for our search strategy, we used 5 different databases, academic databases, pretty common for researchers: Academic Search Premier, SocioIndex Full, ERIC, ProQuest, APA PsycInfo, and Cochrane Library. So we searched all these databases with the following search terms: intimate partner violence or domestic violence, mental health professionals, and practice. And so we did this major search to see kind of what came back. And so the inclusion criteria to be able to be included in this review included it needed to be peer reviewed, it needed to be in English. We wanted to specifically look at non-medical mental health providers, so those who are non-prescribing, so social workers, psychologists, marriage and family therapists. We had some students. So we just looked at any mental health provider that did not technically prescribe medication, and also that were published between 2005 and 2019 was kind of our window of time that we looked at, and then also in the United States. So we know that there is also a lot of research internationally, but we specifically wanted to know what was happening within the US in the context from that cultural lens.
Yeah, and I wanted to add, as far as the non-medical, the reason that we chose to go that route is that because so many of the interventions that we found are medicalized, that there are a lot of actual medical interventions and assessments and safety planning tools that focus on medical providers. And so the gap in the literature was really focusing on those non-medical, so meaning those who aren't prescribing medications, but are still a point of contact for a lot of survivors. Mental health professionals are usually that first point. Advocates are before any other provider, and so we really wanted to highlight that. I just wanted to throw that in there.
Yeah, thank you for that. And so for our review process, we found a little over 1,600 potential articles that were then reduced to around 866 after we took out duplicates. And then after we did title reviews, we were down to 52 abstracts that we screened, leaving us with 44 full articles to review. That eliminated 24 and got us down to 20. So it is a very long, involved process to do a systematic review. You can see we went from over 1,600 articles down to 20, but it is a very methodical process that really got us to the information that we were looking for.
Yeah, and I would say, like, from conception to publication was almost close to 3 years. It was about 2.5 years. So it was quite the journey to get here, but we're glad that we stuck it out because we got this incredible data now that is hopefully helpful.
Absolutely. So within those 20 articles, we really had 5 themes that emerged. We found several 5 qualitative articles, 8 quantitative articles. We had 1 mixed methods article, 2 case studies, 2 systematic reviews, and 2 literature reviews. So really kind of all over the board as far as research goes and what type of research, but really these 5 primary themes emerged for us. And the first thing was lack of preparation and adequate training in DV, which we feel like is fairly, we see, and lived experience supports this. And so we found 8 articles that were related to that topic, excuse me. And a lot of that included lack of confidence in safety planning and assessment, not feeling prepared, not having the right tools, not having the right training to be able to assess for that, to do that work. Specifically when it comes to coercive control and emotional abuse, not feeling comfortable being able to identify those things. I think when we, a lot of what we think about, or a lot of what the public thinks about when they hear domestic violence, is physical abuse. And as providers and as researchers, we know that that goes beyond that. It's psychological, emotional, financial, spiritual, the list goes on. And so really, we found that providers felt really underprepared to be able to address those issues. Amber, do you want to add anything?
Yeah, I think, again, this is just the cool part of this project, is that we're basically, what we found in the literature is exactly what our experience has been in the field. I think when I was coming into this, I thought, well, no, that's just my experience, that, you know, I'm running into people who aren't, you know, adequately trained. And then you find out that from the literature, no, this is actually across the board, that many people are feeling unprepared, or you may have a one-time training if you're lucky, right? And then after that, though, where's the continued education? Where's the continued learning? And sort of just becoming stagnant. And okay, well, we know this, and so we don't really need to look outside for other resources. And again, like Haley pointed out, so many people's mindset relies on the physical aspect of intimate partner violence. And the reality is, and you all know this, right, that you could have intimate partner violent relationships that never once have a physical abuse component. But there's always an emotional abuse component. There's always coercive control, right? And so I think that when we came across that, we were really seeing that people were having a hard time identifying that. And then once they identified it, it's like, what do you do? And so I thought that was spot on with what we were experiencing ourselves. So.
Yeah, and so the second theme that emerged, we found 6 articles that really talked about the benefits of DV training. So those who actually did receive training felt more prepared in safety planning and assessment. Also, if they had agencies that they worked for and they were embedded within the policies that their providers needed to receive training, they were more likely to actually get the training, and they felt more adequately prepared.
Mm-hmm. Yeah.
Oh, go ahead.
Nope, go ahead, you're good.
The next theme that we found is more need for collaboration between service providers, and I think this is something that absolutely matched our lived experience and what we've heard from other providers, is that, and I think Amber had mentioned this earlier, is that so many social service agencies are very, very siloed, and so they do 1 or 2 things and they do it very well, but there's sometimes very little communication between service providers, between different agencies. And so if you have individuals who are experiencing IPV, they might be experiencing other need for services, and they cannot get all the services they need. And so there's a breakdown in being able to adequately help an individual experiencing IPV. We specifically found there was just no connection, particularly around substance abuse and being able to get services that were needed in connection with IPV.
Yeah, for sure. And I will say that when we say service providers, we are talking formal, but also informal. So I think about, from my own experience, some of the most powerful work I did was with churches, was with substance abuse agencies, right? Like, some of those agencies that historically haven't worked together. But once you do, and you start finding that there are informal and both formal supports within communities, I remember specifically for me, and one of my counties actually was a librarian. And she knew everything that went on in that town, right? When you're talking about rural communities where everybody is mated through either marriage or blood, right? Like, everybody's connected. And so finding those contacts and the people that are actually able to provide assistance and services I will also say, and again, I'm speaking from my experience, and so I'm not sure if anybody else has experienced this, but what I have found is that one of the unintended consequences of becoming so professionalized is that what has happened is that agencies become very territorial. They become information hoarders. Like, to collaborate is almost seen as a dirty word sometimes because of the history between service providers and, well, this agency did this and this agency didn't do this. And what happens is that we end up sacrificing resources, and that happens on the backs of survivors. So what I'm here to tell you is that it is our responsibility and duty to collaborate, to share information, to share resources, right? Because ultimately, if our goal is to help survivors and families, right, and even those who perpetrate harm, right, if we're thinking about this systematically, we have to share information. We were not meant to do this work alone. And so it only betters us and our work when we collaborate. And so I will say that as sort of to get on my soapbox, but that was my experience, that so many times I would find people and go, hey, you want to collaborate? And it was like, well, but the history of this agency, I'm like, but who cares, right? Like that means the survivor is losing valuable knowledge. And so just remembering that, that collaboration really is key.
Yeah, that's good. The fourth theme that we found is around stigmatizing attitudes and behaviors towards survivors. And I think this goes directly back to what we were talking about, being self-aware, checking your privilege, bias, power dynamics, those sort of things. But we found is there was a lot of shaming, blaming, disbelief that service providers were sharing with survivors, victims. And I think that it is absolutely critical and difficult for survivors, first of all, and victims to come forward and even reach out for help. And so one negative experience could be the last experience that that individual has. And so really getting around our own bias and really helping those victims understand what those experiences are. I know from my personal experience as a survivor that I had a really negative experience with mental health professionals. I don't think that it was intentional by any means. It was just really lack of education and knowledge, but truthfully it was more harmful in that scenario, particularly marital counseling, to be in that situation than just being harmed by my ex-partner. So just being aware of these dynamics and that there are unintentional consequences when there's lack of education and understanding. Mm-hmm. And the fifth theme is the advocate-survivor connection. And this was not a surprising finding as far as lived experience and what we've seen, but I think really exciting to find this within the literature because it's something I feel like Amber and I talk about all the time, and just this really powerful connection for those who are actually survivors themselves and who are now advocates, which we both identify as. And I think being able to really have that insider understanding and knowledge of some of the intricacies of this work is really valuable, and I think something we often don't think of as an asset to this work, but it can be really powerful. And so there were several articles that talked about that connection, and I think we just want to encourage those of you who are on this webinar today or viewing it later, you know, that is an incredible asset to you within your organization to really have those lived experiences, or just something that you may not necessarily be able to get from a training or reading or knowing, but you have lived a specific your specific story and your specific journey. And so much of Amber says all the time, you know, violence thrives in silence, and so it's that shared experience, that knowing that you're not alone and that there are others that you can connect with.
Yeah, absolutely. And I just want to piggyback off of what Haley said so beautifully, like this idea that it's an asset, right? I'll never forget running groups, and y'all, I love group work. Like, groups are where it's at. I've done groups with so many women, but Haley and I had an opportunity to do a group with incarcerated women and justice involved women, and I'll never forget one of the first groups I ever did. I had a participant afterwards come up to me, and she's like, you really get it. I don't know how or why you get it, but you do, and I can feel it. And I remember that was the first time that a client had actually acknowledged the benefits of my knowledge, right? And I didn't share my story with her at the time. I didn't feel that it was appropriate to disclose, but something about that, she felt it. And this idea of like, you can get things on an intellectual level, and then you can get things on a visceral level. And when you learn to hone in your survivorship, it really does become such a gift, because you do get it on a deeper level that can't be explained. And so again, appreciating it using a strengths-based approach, right? And realizing that what you have are assets. Intersectionality and feminist praxis. One of my favorite things to talk about. So what I will say before I begin, kind of giving you a quick overview, again, intersectionality can be its own topic. It is incredibly complex. As a theory, it's also pretty difficult sometimes to operationalize within your work. And so what we have done is really try to give you what you need to know to affect your practice, because I think that's important, right? This idea of taking knowledge to the field, right? Taking it to the people and to the communities that you're serving. And so, of course, you can't talk about intersectionality without giving props to Black women. Black women and Indigenous women, quite frankly, have been prominent within this movement since its origins. And so it was birthed out of a Black feminist movement, and about 30 years ago became mainstream because of Kimberly Crenshaw and her paper Mapping the Margins. And so basically the idea was that she was seeing that racism was being addressed for Black men, sexism was being addressed for women, but there was nothing that was addressing Black women. And the idea was that as a Black woman, for an example, right, you are never just Black or you're never just a woman. You are always both of those things. Mm-hmm. And so really understanding the intersecting identities. And so, but what ends up happening a lot of times is that intersectionality gets misused. And so I want you to think about it as structural oppressions. So what intersectionality does at its core is it challenges us to think about intimate partner violence beyond a micro level, beyond an individual problem and pathology, right? The very real idea that intimate partner violence exists because there are other structural violences going on in our systems, right? And so if you think about racism, sexism, xenophobia, transphobia, right? Homophobia, this idea of certain religions that are fundamental to our beliefs, right? Patriarchy, the ways in which our society are built. I always like to think about the example of a petri dish. And so if you take all of those things I just said and you plop in intimate partner violence, it's sort of the birthplace, right? It's the perfect breeding ground for violence to continue on. And so until we are able to have honest conversations about these other violences, we're not going to solve intimate partner violence, because those things happen in connection with one another. And so the idea is to not separate that, but to then incorporate that, right? So really reframing the way we think about this work. There is a difference between being social service minded and social change minded. And when this movement started, when the domestic violence movement started, it was social change oriented. And so there was really a connection between intimate partner violence, prison reform, reproductive rights, policies, right? And I think we have moved away from that, and we need to find a place back to that. Because if we're really talking about how to solve these issues, you got to start with the systems and the water, right? As Haley described it earlier, it's all part of the water. We're all swimming in it, right? So how do you learn to navigate that within your roles as advocates? It acknowledges different intersections of oppression. So I just talked about that, particularly the idea that people are not monolithic. There is not a one-size-fits-all approach, because none of us are the same, right? In a lot of ways, we have different identities. We may have some similarities, but at the end of the day, at our core, we're all very complex beings. As you saw earlier with our positionality statements, you know, we're all complex. And so our survivors and the people we work with are not monolithic. The people we supervise are not monolithic, right? And so really understanding that. And again, kind of this idea of like, one cannot have a movement without actually moving. And so the idea of feminist praxis, in very simple terms, is that you're taking theory, you're taking intersectionality, and you're applying it to your work. You're taking actionable steps that support and honor lived experiences of people and their identities. It calls us to individualize interventions. So this idea of being survivor informed. So not even survivor-centered. I think we're moving away from that, but really being informed about, from survivors themselves, what they want, what is helpful, what's not, what their experiences have been, and to question policies. So this idea of questioning, certain aspects of VAWA and why it hasn't passed the Senate, or Medicaid expansion, reproductive rights framework, right? This idea of sex education and rights, and how all of these things kind of lead to violence against individuals. And so really understanding, who benefits from these systems and how. I think the criminal justice system, I'm not going to get so much into this, but I think this is a perfect example that the criminal justice system benefits certain groups of people, right? And some communities would argue that they don't, that's an institutional violence for them, that they don't feel protected and heard. And so we really need to think about the systems that were built and how they're affecting the people that we're working with. So again, we're moving beyond this harmful binary thinking, particularly around what it means to be safe, and this idea of moving beyond telling people to leave. And we're going to talk about that in a minute, because I think that for both of us has been a real big point of contention. And we have seen firsthand, not only through our own lives, but the lives of others that we've worked with, that is incredibly harmful. It is not helpful whatsoever. So again, this is a perfect place to pick up that conversation. But so the recommendations within our paper, based on the data, is that we're bringing attention to effects of violence that go beyond physical. Physical abuse is real, absolutely. I have seen horrific physical abuse cases. And like I said earlier, though, there are always other components of abuse within those situations. And so really respecting and making room for coercive control. Okay, if your client has to educate you on coercive control, you haven't done your work. Okay, if we have to explain to you what emotional abuse and gaslighting is, okay, that's a problem, right? Because those things are so pertinent within intimate partner violence. And so being a mental health professional, being a responsible consumer of that information, and Haley, feel free to jump in at any time if I'm missing something or you're feeling inspired, because we have really impassioned conversations about this, because we've just seen it so many times. The forms of abuse that Haley mentioned earlier. And so financial abuse, okay, it has taken me years. Like, I think I knew it early on, but I will say, I'm telling you, I think economic instability is one of the biggest barriers for survivors, particularly women's, particularly people from communities of color. If you don't have childcare paid for, you can't find a job that pays a living wage, right? Like, you're not going to leave a situation, right? Like, it's just impossible, the things that we ask people to do without taking into the entire context of their life. And going from a working professional, which I still am, right? But like full-time to like a PhD student where I barely make a living wage and now have a child to take care of, I can completely understand why people would be like, it's just easier if I just stay in this right now, because I have to put food on the table, right? I have to buy diapers. And so really kind of meeting people where they are. Implementing assessment tools and practices, again, that account for intersecting identities. One of the best safety planning tools that I have come across that's backed by research is actually the VIGOR. It's VIGOR. It was introduced by Sherry Hamby, who is a researcher. I like it because it is asset-based, and so you're not just looking at barriers and risks, but you're looking at what strengths does the client or survivor bring to the table. And so it's more of a conversation piece. It's not just like listing out things to do, but it's really thinking about what are the barriers, what are some things that are keeping you from being able to access so-and-so service, and is leaving even something that you want to do, right? And so again, moving beyond this idea of like, once somebody leaves, they're safe. Once somebody leaves, they're out. What about co-parenting situations? What about people with kids in common? What about, right? Like, what if somebody just chooses not to release that person from their life, right? We have to understand that people's decisions are complex, and we're most of the time only getting the surface, right? We're only getting what they share with us.
Yeah, that makes me think about the next one around incorporating positionality and reflexivity to challenge our assumptions, privileges, and biases. And I think I think we have the best intention in mind, right? Like we think, oh, well, if people will just physically leave, they can get out of these situations. But I think that's a huge bias and assumption, particularly if you're someone who is white or upper class or has the ability to do that. But even those populations don't necessarily have the ability to do that. And assuming that they do, I think is huge, because for you, you may think, well, the best thing is for them to leave, but they may not be ready to leave. They may not want to ever leave. And we have to get comfortable and be okay with saying, what they choose is their autonomy and their choice, and to be supportive of that, whether that is what we would personally do or not. I think that's one of the hardest things of being a social worker or a mental health provider, is being okay with people's choices that would not be our own choices or would not be how we would handle the situation, and still being a good service provider, and still meeting people where they are, because they're, like we talked about intersectionality, there's so many different levels of oppression and steps and things that it may never be plausible for people to leave ever. And so I think we have to reframe the way we look at these issues. So what does it mean to help? You know, what does it mean to be supportive? What does it mean to walk alongside with people and meet them where they are?
Absolutely. And again, leading into do your own work, right? Do your boundary work, do your professional work, do your ethical work, right? And really, when you're having certain reactions to survivors, when you're not agreeing with what they're saying, like, you need to look inside yourself and go, why is this making me uncomfortable? Why am I so against them doing this, right? Like, is this out of concern? Is this out of me wanting power? Is this out of me wanting a right answer? Like, what's driving the way that I'm interacting with survivors? And you all probably know this, right? Working in this field, like, there is separation violence is real. Separation abuse is real. The most dangerous time is when somebody has either announced that they're planning to leave or has left, right? And that journey after. Divorce proceedings, custody agreements, right? All of these things are can be incredibly dangerous and complex. And so again, reframing when we just tell people to leave, well, okay, what does that mean? What does that actually look like? Inquiring about past experiences with providers. So again, having this program evaluation component, and this is something that anybody in an agency can do. Having conversations about survivors themselves, like, what has worked well for you? What could have been better? What are some things that we offered you that were really great? What are some things that you wish we would have? And being open to receiving feedback. Again, so if you want a true collaborative relationship, right, you have to be willing, if you want to give advice, right, you have to be able to receive it back. And so really honoring them and going, you know, you all know best, like, what has been your experience? Seeking out continuing education and training. So again, it's not just a one and done, it's a lifelong process. There are still things every single day that I learn about IPV. And oftentimes the unlearning is going to be harder than the relearning, right? Like, there's a lot of things that I have been told or shown throughout my career that have actually not served me very well. Particularly around the way that we organize cultures within our agencies. If you've got an agency environment where you're standing around talking about survivors and not supporting one another, if you have supervisors who, you know, squash creativity, right? Well, then you need to really ask yourself if you're in a supervisory position, right? What does my staff look like? How diverse is my staff? Are we truly representative of the communities that we're serving? Okay, so the questions to ask. And then, of course, be aware of ethical considerations, be transparent about confidentiality. So again, being upfront about your limits about mandated reporting. I always do that up front because I never want to feel like a survivor sharing something with me and then I'm like, oh, by the way, gotcha. Just kidding, now I have to go report this, right? Like, so being transparent about your limitations as an advocate is really important because that builds trust, right? And so then if they choose to share something with you, then you know you've created a space safe enough where they feel that they can do that. And then, yeah, emphasize the survivor informed model. So the whole time that we've been talking, that's exactly what we're talking about. Okay, so we had some additional resources again. So as we said in the beginning, that this is not an exhaustive webinar, but so if there's areas that you want information, there's agencies that are already doing really incredible work. And what I wanted to leave you with, and Haley and I were talking about this earlier, is like, please don't underestimate the power of creating safer spaces where survivors can be heard and listened to. I know sometimes it doesn't feel like enough, and I know like we want to overhaul systems, and that's great, right? But like the reality is you have to find ways to navigate this work and still feel effective and not lose hope in the work itself. I know I've been there many times, like I just want to throw my hands up and go, why am I doing this? It's a waste of time. It's 10 years in, we're still dealing with the same stuff. But hope is resistance. Hope is a discipline, and it's a way to rebel against systems that tell us time and time again, like, you cannot win. And the reality is that I've seen it, that when you hold space, when you allow survivors to come in and hang up their armor, even if it's just for 30 minutes or an hour, that's a gift. That is the work. And I didn't know, Haley, if you had anything else you wanted to add, but I mean, that's how I feel so strongly about that. And I know that we've seen it in the stuff that we've worked on.
Yeah, I think sometimes we feel like we need an answer, we need to do something, we need to provide something. But I think one of the greatest things that I've seen the power as an advocate, as a survivor, I think is sitting with people in their pain and being present with them in their pain and allowing them to grieve through it and to feel like that's enough. Of course, there are other things that can come after that as well, because it's a process, not an outcome. But I think continuing to recognize that it's a powerful tool as well. And I just wanted to share something I came across the other day. A couple of years ago, when I first went to an organization to receive support as a victim, I found I was given kind of a little care package, and one of the most valuable things I received was a handwritten note that says, "Dear Survivor." I didn't find it till I got home, and I just wanted to read what this said. An advocate wrote this and put this in the care package, and it says, "Dear Survivor, I am so sorry for what has happened to you. I can't imagine how you are feeling, but I know your feelings are valid. Please remember that you are not to blame. I admire your bravery and resilience during this difficult time. I believe and support you." And as simple as that is, it has been something that's been so powerful and has meant so much to me in different phases as I continue to walk through. And I think that it may seem very simple, but it's something that you can go back to your office right now and do. And, you know, I think things like that can be very meaningful and powerful. And the power of words and support, particularly if, like we mentioned, those who are experiencing emotional abuse, who are being torn down on a regular basis, who are not hearing positive words, who are not being believed, who are being gaslit, just to hear someone say, like, "I believe you," can be really powerful. And I just wanted to share that.
Thank you. So here's the link to our systematic review. I also was reminded before we started that you can request a copy of this from the librarian from the Center for Victim Research. And so if you have questions about that, please reach out. We would love for you to be able to actually read what we put together. And if you have, additional questions or need information, it's all in there. So we thought that was important to share. And then, of course, our contact information. And I think we both have said earlier throughout this presentation, we're happy to have one-on-one conversations. If you feel like you needed something that you didn't get from this webinar, or just want to troubleshoot or process with somebody who is also doing this work, please feel free. Again, we need each other, and we're here to pay it forward. And so I was given space to do that, and so I want to be able to provide that for you as well. And so questions or thoughts, we would love to hear it.
All right, thank you so much for this wonderful presentation. Folks, remember you can enter your questions in the question box. We have had a couple of people asking about slides, so as a reminder, you will receive a link to the feedback survey, and that's where you will be able to request a copy of the slides. Give me a day or two and I'll be able to send them to you. You will also be able to find the recording of this webinar on our YouTube channel and on our website. We did have some comments echoing what you were talking about earlier about the importance of having background in the domestic violence field, in some programs being too professionalized, but losing track of what it means to be a survivor. So, for example, homeless and housing organizations now moving into the domestic violence field, or sexual assault or human trafficking, but the housing authority does not understand these crimes or what it means to be a survivor. They are often unqualified or untrained. There's a lot of turnover in some of those. They haven't had empathy training. They don't understand screening and assessment. So any comments on that?
So one, thank you for that comment. I totally agree with everything that person shared. I have experienced that so many times within my own work. And so again, I think when we talked about this importance of collaboration, what it means as an advocate to build bridges between other service providers. And so you're right that no one advocate can know everything, cannot know every channel of a service, right? And so again, the housing authority is a perfect example of that. When we collaborate, it gives people permission to stay in their lane, if that makes sense. And so, the idea of working across disciplines for survivors, a lot of times our work as advocates is spent training other professionals about what it means to work with survivors effectively. And so what I will recommend is that continue to do that work, continue to build those relationships. I think that's always going to be a hazard of being an advocate, is that you feel like you're constantly having to educate everyone. Because again, I think the thing that makes intimate partner violence so different from any other social problem is that it's so ingrained in our societies that oftentimes we don't even recognize that it's existing, right? We don't recognize its impact across sectors. And so that was initially my reaction, is that I totally get where you're coming from. And I will say that again is why we stress the importance of collaboration. And that's exactly what we found in the data, is that other advocates were also expressing that. And so you're not alone in thinking that. Haley, did you have anything you wanted to add?
No, I think that was good.
Okay.
I had another question come in. Do you believe trauma therapy is a help in the domestic violence field? And is there a trauma crisis certification program that you recommend?
So one, I think any information about trauma is absolutely helpful. I think part of being survivor informed is also being trauma informed. And so if you recognize IPV as a trauma, which it absolutely is, and most of the time it's a complex trauma, I'm not sure of any specific to IPV, but what I can say is things like trauma-focused CBT, such modalities as EMDR. But I will also say, again, thinking about tools that people can use, such as trauma narratives, are really important. I have used that across my work. It's something that you can easily look up in Google. It gives you prompts, it gives you things to talk about. I think working on things like grounding techniques before you jump into a trauma narrative is really important. And also just working on body movement, right? Getting back in touch with your body. There's a lot of mindfulness and things that people can do to sort of address trauma that doesn't necessarily take a degree. It doesn't necessarily take a certification, right? If you want to go that route, that's fine. But I also think that there are things that are more grassroots, such as writing. That's an incredibly powerful trauma tool. I'll say art we've used within our groups, drawings and Play-Doh and things that you can really, that are sensory. And I'd be happy to have a conversation with that individual for more information. But off the top of my head, that's what I would say.
Yeah, and I would add, I think, again, certifications are great, and I think you can learn a lot. But I think for someone who's newer to this field, for me, I think one of the most important things, understanding trauma, was really learning more. And there's plenty of literature out there to learn about fight, flight, freeze, and fawn. Really, those different responses that people experience. Because it's you can tell someone, oh, go do like a personal safety violence training, but like if that's not their physical response, if their body literally freezes in a trauma response, and that's not going to be helpful. So really helping, like, understanding that yourself and being able to help people identify what are their trauma responses and how different tools that Amber mentioned could help reorient.
Mm-hmm. Yeah, and there's a great 8-minute video called Trauma in the Brain that explains it in a way that's understandable, because I think that's the thing too, like we're not neurobiologists, right? Like we're not like in the brain every single day, and so sometimes it can get a little complex. But that video sums it up really well, and I'm happy to send that link out as well. But I've had clients just explaining trauma, and they're like, "Oh my goodness, I feel so validated. That's exactly what I'm going through, and I didn't realize that it's my physiology, right? I thought something was wrong with me. In reality, your body is responding exactly the way it's supposed to." So again, validating.
So we had a comment that the danger assessment is a great tool to assess danger in a relationship with a client, and that website also has a great training to assess IPV. We had a question, do you have some tips and tricks for active listening and ensuring survivors are heard and respected when speaking and communicating, primarily by phone, which I guess is especially important with COVID and the pandemic, or people who don't have good transportation?
So I think over the phone is tricky, but I think it can be done. And I think it's the new normal that we're going to have to adjust to is more telehealth and over the phone and online modalities. What I will say, and this is a hard skill, and this is something I have to practice all the time, active listening requires that you are listening without forming a response. And so if you find yourself, you're hearing somebody talk and you're already thinking about, okay, this is what I'm going to say, this is how I'm going to respond, that's not active listening. And so asking one question at a time and giving time and space for that person just to let it out. It doesn't have to be organized, it doesn't have to be linear. What I always like to do when I meet with survivors is just tell me your story, tell me how you got here, uninterrupted. I don't ask any follow-up right immediately. I'm not asking, specific questions. I'm just letting them tell their story. And then after having a conversation about things that stuck out to me. But I think initially just making that space that's uninterrupted, that you're not distracted in, is really important. And I know being an introvert on the phone, it's awkward because sometimes those pauses throw me off and I like to kind of jump in because I'm waiting too long. And so I think just knowing yourself and doing your own prep work ahead of time, like, okay, I'm gonna ask a question, throw it out there, and if it's silent for a minute, it's okay. Like being okay with silence.
Yeah.
I think is really important, and it's hard because we want to fill that space. But I think when somebody starts talking, we're just, just let them have that time.
And I'll add on the flip side, as an extrovert, it's really hard, again, like Amber was saying, for me not to want to come back with an immediate response and just sitting and waiting. But I think that, it is something, it's a skill. I think it's something you can learn. I think it's something you can practice with your family members, with your friends, with your colleagues, really trying to focus in on, like Amber saying, asking one question and listening. And for me, the hardest thing is getting comfortable with silence. And I love working with Amber because she will just sit there and let the silence happen. And so I've really learned a lot from that and how valuable that can be, particularly for introverts who need some time to process before they give a response.
Another comment and question. IPV is often framed as a woman's issue, which of course overwhelmingly it is, and you briefly touched on this, but as a cisgender gay male IPV survivor, I often feel unwelcomed in this space, in these conversations. What do you think the field and practitioners can do or have been doing to change that?
So I think this starts with one, understanding and bringing light to that issue. And I thank you for bringing that up because I think it's important. I also think within your own organizations, when I talked about this earlier about diversity and what your staff looks like, I remember working in an organization that we had somebody who identified as a gay male, we had other queer folk, we had women of color, we had, right? Like, and so really being intentional about advocating and setting up space where multiple identities are welcome. I think historically this movement has been a white middle-class woman movement, and that's just the history of it. But I think that knowing that other survivors are being impacted, that we have a lot of work to do, I think that's encouraging because that gives us permission then to be more intentional when we're doing this work. And I'll be very honest that, that's my viewpoint, that's the work that I've done. It's also probably assumptions I make within spaces, right? But like the majority of my work has been focused on women. And so I completely understand how somebody who doesn't identify as that could feel left out. But what I will say is that we absolutely need you in this work. We need different perspectives. We need your lived experience to help come along and and educate about how this work can be effective for you and for other people that identify similarly to you. So hopefully that helps. But thank you. Thank you for being a part of this.
Yeah.
We have had a request for the link for the trauma and the brain video you talked about. So we'll try to find a way to get that out to people. And our librarian has recommended authentic relating games, which are very good active listening practice exercises. Maybe we can look for a link for that to include also. And with that, it looks like we have completed all the questions and comments. There are a lot of thank yous here, a lot of people expressing their appreciation for this presentation and your work, a lot of interest in your paper. So I want to thank both of you for spending so much, first of all, for your work, and then spending so much time to prepare and then share it with us here today. So thanks so much.
Thank you. Thank you. Thank you. And thank everyone that's on this webinar. We really appreciate you and your work. So thank you.
Yes.
It takes all of us.
So much for having us. Thank you.
All right. And with that, goodbye, everyone.
Bye.